Good evening, everyone, and a very warm welcome to all of you to the Let's Talk series presented by Aesthetic Medicine Magazine, powered by Galderma. Within a short span of time, our Let's Talk series has grabbed the attention of the aesthetic fraternity, and we are happy to bring to you our sixth episode, which is about the non surgical facelift with Restylane Lyft and Defyne. I'm Kanishka Ramchandani, the consulting editor of Aesthetic Medicine India. The magazine is over 18 years old in the United Kingdom and 3 years young in India. We celebrated our third anniversary with the second edition of the Aesthetic Medicine India Expo and Conference in the month of May in Mumbai. The conference had renowned aesthetic practitioners, dermatologists, plastic surgeons participating in panel discussions and live demonstrations, while the expo connected the medical fraternity with the supply chain stakeholders, thereby becoming a sought after platform for sourcing, networking, and training. The event was attended by dermatologists, plastic surgeons, cosmetologists, and aesthetic clinicians. The success of the event was a milestone for India's aesthetic medicine community as it indicated business as usual in the new normal after almost 2 years of pause. The event also witnessed the comeback of the print edition of the Aesthetic Medicine magazine through our virtual efforts of keeping the community informed and updated throughout the pandemic. We are now delighted to be its partners both digitally and in print. To stay updated about Aesthetic Medicine magazine, you can follow us on social media, Instagram, Facebook, YouTube, whichever medium you prefer. Coming to today's episode of Let's Talk, it's about non surgical facelift, and we have with us two aesthetic dermatologists who will discuss the topic in detail along with their case studies. Our experts for today are Dr. Sadhana Deshmukh and Dr. Siddhi CHAVAN. I am delighted to introduce you to our first subject matter expert, Dr. Sadhana Deshmukh. She is an aesthetic dermatologist and trichologist practicing in Mumbai with more than 15 years of experience. She is the medical director of Forever Young Dermatology Skin Hair Laser Clinic in Bandra. She is a postgraduate dermatologist and dermatocosmetologist from BYL Nair Hospital, Topiwala National Medical College, Mumbai. She has done her fellowship in dermatologic laser surgery and cosmetology. She's a promoter of Perfect Image Cosmetic Clinic and a consultant at Joy Hospital, Mumbai. She is also the medical advisor at Palais Royal. Welcome, Dr. Sadhana. Delighted to have you here with us on this webinar. Our next subject matter expert is Dr. Siddhi CHAVAN. She is a dermatologist, trichologist, and dermatosurgeon in Bandra, Mumbai, and has an experience of more than 10 years. She is an alumni of the BYL Nair Hospital, Mumbai. She's also a member of the Indian Association of Dermatologists, Venereologists, and Leprologists, that's IADVL, Cosmetic Society of India, that's CSI, and the Indian Medical Association, IMA. Welcome, Dr. Siddhi. We are looking forward to this session with two of you who are an expert on this subject. However, before I hand over the session to you, there is a short instruction that I would like to give to our audience for today. I would request the audience to place their questions in the Q&A box below. You can use the chat box to communicate with me in case you have any audio-visual issues, but put your questions in the Q&A box so that we don't miss it out. Doctors, we will have 40 to 45 minutes at our disposal to discuss the topic and the case studies, followed by a 15 to 20 minutes of open discussion and questions from the audience. So over to you, Dr. Sadhana. I shall be running the PowerPoint shortly, and you can take over. Thank you.
Thank you, Kanishka. And we can, am I audible? Is it proper? So today we are going to discuss a non-surgical facelift or a non-surgical face rejuvenation with dermal fillers, and we are going to talk on Restylane range of fillers. So if you can start the presentation. Yes, so it is non-surgical facelift with Restylane, Lyft and Defyne. Lyft and Defyne, as we know, that these are the two different portfolios for a Restylane group of fillers. Can you change the slide?
Doctor, give it a second, it's changing.
Hmm. I'm assuming that many of you would be injecting fillers and maybe different brands of fillers. And today we are going to talk about Lyft, Defyne, and where to use these particular fillers on for what indication and for which area. The different products of Galderma are Dysport, which is a neurotoxin, and in Restylane range, we have Restylane Lyft and we have Restylane Defyne. Then also we have plain Restylane, then we have Restylane Kais, and we have Restylane uh, Volume. And also we have skin boosters. And the aim while doing non-surgical facelift is to give a relaxed, refreshed, and a refined look to our patient. Change the slide. So, Restylane group of fillers, they follow two technologies. Like one is Nasha, which is more for lifting and for giving more projection and for to giving a precise what you call it, precise contours. And then there is OBT technology, which is optimum balance technology. And these products, they are more for a softer look when you want a softer filler, or the filler which gives a little smoother appearance or a volume. Then we use these group of fillers. Change the slide. So what is NASHA? It is non-animal stabilized hyaluronic acid, and it has less than 1 degree of cross-linking, and it has controlled particle size, 2 degree of gel particle sizing. Different gel textures, controlled particle sizing result in distinct gel texture for different lifting capacities. So change the slide. So we know that the Nasha fillers, another technology is OBT technology, which is optimum balance cross linking, and it has 4 degree of cross linking for variable firmness, 3 degree of calibration of variable particle size. Change the slide. So the different fillers of Restylane group is one is Restylane boosters, or earlier we used to call it Restylane Vital, and it is basically for hydration. It is non-cross-linked. For tear trough, we use plain Restylane, and plain Restylane follows Nasha technology. And another Nasha product is Restylane Lyft, where we want to use the product when you want to give structure. Like for example, you want to create a good chin, or you want to give sharp jawline where you want projection. Then we use Restylane Lyft. Now, Restylane Defyne, Kais, and Volume, these are OBT technology fillers. And Defyne we use when we want a little softer look. Volume is to give volume, to give firmness, and also it has some lifting capacity also. But it is primarily used for filling. And of course, Restylane Kais is for lips and perioral area. And the aim of the filler and the different filler products is to give the natural look. Change the slide. So what is more important when we have to decide which filler to use from the portfolio for which indication? It depends on the firmness or the hardness of the product, and we call that the G prime. What is the G prime of that particular product? So Restylane Lyft has the highest G prime amongst the different fillers available in the market, and you can see that it has the highest G prime of 800. So it is the filler of choice for chin, for to give chin projection. It is the filler of choice to develop a contoured jawline. Uh, yeah, you can change the slide. And then the OBT technology products, they are more for a softer look, like you want to do the mid face cheek enhancement, you want to uh, do the marionette lines, you want to, so it is always a combination of fillers. So like for lower face we can always combine lift and a volume. For mid face, we can combine lift and volume. So lift, though it is for lifting and it's a harder product, but yet it is used for even for mid face contouring and also for the jawline contouring. Next slide. Yeah, before we start injecting, we know our different. We should know that the main important thing is to know the vasculatures and what are the danger zone areas. Facial artery is our main, artery where we have to be really careful, and that's why we always say that when you're injecting the filler, aspiration is very important. uh, Nowadays with the upcoming trend what is setting in, it is always better to use fillers with cannula so that you are safe. You have to put your filler product in a particular depth, like when it is on the periosteum, or you have to put it like when you're doing the tear trough and you're using a cannula, you can be in a subcutaneous level also, but you have to select the product and accordingly we can go ahead with the injection. uh, do you want me to go in details about the vasculature? I think we'll go on the next slide when we discuss cases. That time we can discuss them. So the main artery, change the slide please. Let me see the next slide. No. Okay, go back on the first slide. Go back on the previous slide.
Yeah,
Previous slide.
just a second. I'm done. I'll reshare the slide. Just give
No
me.
problem. No problem.
Are you able to see it, doctor?
Yes, 1 second. I'm just opening it on my. Yeah, so when we inject, if you can see that when we inject, we are most concerned about the facial artery. Facial artery enters the face. It enters the face at the angle of the mandible, and then it runs on the ramus of the mandible. It enters the face from the antero-posterior border of the masseter muscle, and then facial artery becomes tortuous in the nasolabial fold. It gives two branches, like on the lip, superior labial and inferior labial, and then it becomes tortuous and it becomes angular artery. Basically, right now, what we are going to discuss for that main important artery, what we need to keep in mind is facial artery. Uh, Now, we'll go directly on the case discussion. You can start the case, you can change the slide. You can show both the pictures. So basically, she is a 30-year-old female, and she had come for the tired look, and she had come for basically the tear trough injections. So in this case, I will tell you what product I have used and how I have done this case. But I would like to ask Dr. Siddhi that if such kind of a patient comes to you, how will you evaluate and how will you proceed with your treatment, and what are your product options for this particular patient?
Yeah, hi. So definitely she needs tear trough correction because when you look at a person's face, I think the eyes and the area around the eyes is something that you notice first. And the tear trough definitely makes a patient look tired. So uh, that is definitely something that we need to address first. For her, I would choose a product like Restylane ideally to correct her tear trough. But we can also choose a product like Defyne, where we can correct the lower part of the tear trough as well as the medial part of the face, because she looks a little older. Like you mentioned, she's 30, but she definitely looks older than 30. So we could give her a little melar eminence as well. Also, what I feel is she needs a little correction of the temples as well. So to lift her lateral side of the brows and just open up her eyes also a bit.
Yes. So, yes, you can see that she has a little bit of a melasma also on her face.
Yeah.
And what happens that when you have tear trough and when there is sagging, and the melasma also adds on to that sad look. So yes, I had used Restylane for her tear trough, and also I had used volume for her mid face. Though I haven't done her temples in this particular, like at this particular sitting, I had not done her temples. So I had used 2 ml of fillers, like one Restylane for the tear trough, and for the mid face contour, I have used volume, and I have done this with cannula. So, how do you use cannula or you use needle?
I use both. So for tear trough, jawline, I prefer the cannula. Other areas, I prefer using a needle.
Okay, and and also we know that even if we say that cannula is safe, so 90% of the time cannula is safe, but cannula can also cannulate the vessel. And so, do you aspirate when you use the cannula?
Yes, I do.
Any other products you would like to use on her?
Yeah, I think she would do well with Restylane Vital or the skin booster as well, because it will, since she has melasma, boosters really work well with those who have pigmentation, or her skin looks a little dry and dull as well. So it will just brighten up her skin as well.
Here, while doing tear trough, the main important arteries what we have to see is infraorbital. And when we can you see my cursor?
No.
No, okay. I think because she's managing the slides. Okay. So basically, when we do tear trough, we always do the marking, and we draw the mid pupillary line and the mid limbal line, and we palpate the infraorbital foramina, and that is our no-go zone. And there, the important vessels are infraorbital artery and vein from the foramen. So we have to be always careful, and when we do the tear trough, we do a marking where we draw a line, which the line just below the lower eyelid, so that you know that that is your demarcation for the upper limit of your filler product deposition. And uh, and for the mid phase, the artery which is very important is the transverse facial artery, That's why the aspiration while doing these areas are very important. Cannula is really safe, and you can avoid bruising and vascular complications also.
So, which cannula, which gauze cannula do you usually use?
Earlier, I used to use 25 gauge cannula, but now I use 23, because 23 is it gives a smooth, like you don't have to struggle for the cannula, because many a times when the product is hard, especially for lift, sometimes the cannula bends. Like the 25 gauge cannula, there are chances that the cannula can bend. So I use 23 gauge cannula.
Uh,
Yeah, next slide.
all right. So this is my first case. So basically he's a 35-year-old male. He basically has a oval shaped lower face. So he wanted a little more broader or more square shaped face. Wanted to look a little more masculine. So, Dr. Sadhana, how would you go about in such a patient?
Yes, male patients, they usually like a little broad and a muscular face, and especially when they are like, if they are lean, then they like more what do you call it, the angle projections and the more
Absolutely. Yeah.
profile projection. So I think I would do his lower face, like I will do the jawline. So I'll do the angle of the jaw, and of course I'll do his chin. Male patients, I feel that chin and jawline gives them more what do you call it, more angles and more prominent profile pictures and more sharper look. I
Absolutely.
think for chin, ideally, I mean, to do the lower face, ideally, a good number of fillers is like 4 to 5 ml. But sometimes with whatever constraints we have, ideally at least 2 to 3 ml fillers would be required for him. And I would do with lift and volume.
All right. I have used Lyft. I have used 4 ml of Lyft in this patient. So we've started with the mandibular angles, and then we've gone vertically up and made the mandibular angle more prominent. And then with the cannula, I've gone along the line of the mandible, and we've made enhanced the jawline. Then we treated the chin, especially the C5 and the C3, to just enhance, because he didn't want to increase the length of the face.
I was going to use these codes, but then since I thought that these codes, I mean, can we use these codes?
Yeah. So we didn't want to he didn't want to increase the length of his face or want too much anterior projection. So we just wanted to enhance and make it a little more square shape. So that's what we've done. So we use total 4 ml of lift. Like you rightly said, most patients have financial constraints. So we can start with 2 ml and then build it up over the next few months. So that's a good way to go about it. And I've used cannula along the jawline. And on the chin, I've used the needle.
Yeah. I think we can take the code names now. Or
Yeah, I think it should be fine.
fine.
So the patient was quite happy. We managed to, convert his U-shaped lower face into a more square shape and give him a little more masculine look. Because he was lean, so he wanted to look a little more manly from the face, and I think we managed to achieve that.
Yes. Also, another thing, when we do the chin fillers, especially on the chin, and if you are using a needle, chin is the area which gives lots of bruising and pain, and many a times patient feels that there is difficulty in opening the mouth or while eating food, but that usually resolves in 2 to 3 days. So for
Yeah, so
downtime is what we
yeah.
have to expect.
So yeah, somebody is asking, I think, what is the time to repeat this filler? So most of these fillers usually last for an average 1 year. So you can repeat it after the year, or another way going about is you build it up over a period of few months. Then the next time when you have to repeat it, you can repeat it after about 12 to 18 months.
Yes. So basically, it also depends on the lifestyle of the person. Like if smokers and all, though the literature says 1 year, sometimes in smokers or when you have like a little undisciplined lifestyle, then the fillers uh, can it can go little earlier. Like we can then
Yeah,
repeat.
even those who work out a lot, so who do a lot of cardio, we've noticed that the fillers last a little lesser than the other patients.
Yeah. Next slide. Yeah, basically, uh, this is my patient where we have done her lips, and I have done her lips with 1 ml of Restylane Kais. And as you can see that her lips, her lower lip was bigger than her upper lip. And nowadays, patients they want 1:1 ratio filler. So they want both the upper lip and the lower lip similar. Like earlier, we used to say then the upper lip should be slightly smaller than the lower lip. But nowadays, so that's why I have used, and I because her upper lips are very thin, I think that, about a zero point 0.8 ml or so I have used on her upper lip only, and she wanted to do only 1 ml. So the remaining zero point 0.2 we managed on her lower lip.
Oh,
So for her, and she had done this for her wedding. So what we have to understand that nowadays it's not that the patient has to be from any film industry or from the media or from acting background. Even normal people, they are now so influenced by a lot of influencers, so they also want to do fillers before their wedding or before any important event. So she is someone, a salaried person, and wanted to do fillers for her wedding. So I would like to ask you that what would you do? Like you would tell her to do 2 ml so that
no, well, I think 1 ml should be good enough, and she's managed to. You managed to give her a good result. So also, I noticed that she has a little symmetry in the upper lip. The one side is slightly more flatter, and the other side is a little more, bigger than the other side. So also, her mentolabils can be corrected. Her mentolabils are a little more prominent, especially on the sides. So probably the oral commissures can also be treated at the same time.
yes. Would you want to add anything like, but her picture is only, I mean, in one picture you can see her little bit of marionette and chin. Uh, uh, she has a little oval face.
Oh,
So for oval face, when we do masseters with Dysport, would also give a good definition.
true. It will
Because
make her
she's
face look
young and
slimmer.
sometimes yeah,
Okay.
sometimes a lot of youngsters, when
Mhm.
they are new to fillers, they directly don't want to go for a chin filler or a jawline filler.
Mhm.
So it is always better to do the masseters with toxins first, and then maybe tell them to do
Mhm.
fillers. Next slide.
All right. So this patient, she's a 45-year-old female, and she has a very round, chubby face. So she wanted her face to look slimmer. Also, she has a lot of melasma. Dr. Sadhana, how would you go about in this case? Would you just treat her with fillers? Would you use any energy-based devices? How would you go about, and make her face look slimmer?
See, when any patient, when they have melasma or any skin condition,
Mhm.
uh, they get really disturbed with melasma. Melasma is, as such, a very disturbing condition. And no matter whatever lift and contour you give them, unless and until if you don't treat their melasma,
Mhm.
they are not going to be happy. And as we know that melasma is something where we can only reduce the pigmentation, we cannot 100% cure it, but when the pigmentation goes down, like I can see in your post pictures that the pigmentation has gone down
Mhm.
tremendously, and that is something they get motivated, and then they are more motivated to do more further procedures. So I would definitely treat her melasma first.
Mhm.
I'll be little, I'll be little careful rather while doing the energy-based devices. Maybe
Mhm.
if I do, I will do a radio frequency or a HIFU, but you have to be really careful because she has
Mhm.
melasma, and the energy-based devices the uh, with the heat, sometimes the melasma should not get aggravated.
True.
So that is
Yeah.
something one has to keep in mind. And after I see that her skin texture and pigmentation has improved, then maybe, of course, can do her fillers. She definitely, because she has bulky face, she will do very well. Like, we'll have to treat her mid face. So, like, you have to
Mhm.
lift her mid face up and treat the marionette. So yes, ideally she would need 5 to 6 ml, but if she's okay, and sometimes for such patients who needs like 5 6 mls, you can always divide it, that do 2 ml, and maybe after 2 months do the remaining 2 mls, and build it up
Mhm.
as you said in your previous slides, that you can always build up the fillers.
Yes. So basically, yes, we were treating her melasma throughout. I treated it with Cosmelan, so we managed to achieve a good result. And so basically, since her main concern was the bulkiness of her face or to reduce the her chubbiness, so we started with the the high intensity focused ultrasound, and then we did toxins for the masseters, and so we treated a period of 3 to 4 months. So this result is achieved in a period of 4 months. And then finally, we treated her. We treated her upper face, or we enhanced her cheek with Restylane Lyft. I used 1 ml of Lyft, which is divided on each side, and then we used a little define around the lips and on the marionette lines. So we've used a total of 50 units of toxin and 2 ml of filler. So 1 ml of Lyft and 1 ml of define. So by then the results of the HIFU also started showing, and the melasma also started responding to the treatment. So this was the result after about 4 months.
So will you do the HIFU first and then you would do the fillers, right? Because
Yes, I prefer doing the energy-based device treatments first, and then after maybe 6 to 8 weeks, I treat them with the toxin or the filler.
yes. So what they say that any device which for which it absorbs water, like where water is a chromophore, for example, for many laser devices, uh,
True.
those sessions should be done before the fillers. And once you do
Absolutely.
fillers, then you should avoid all the energy based devices at least
Yes.
for 6 to 8 months. Next slide. So somebody is asking that anesthesia. So yes, we put numbing cream. Numbing cream is applied half an hour prior to the procedure, and then after that you can do the procedure. Can you once again explain the procedure of tear trough? Yes, some software.
Maybe we can take up the questions later.
Yeah. Yes, yes, I'll do that. So again, this is she is a 60 years old female, and if you see that she has a really bulky face and which is sagging, she has lost like a lot of weight, and if you
Mhm.
see that her nasolabial fold is almost grade 3, grade 4 fold, for such patients, sometimes we cannot give them like 100% result, because the cheekbones are really heavy, and then we need to add uh, multiple technologies along with the fillers. So for her case, on her face, I have used for the overall face. Though her main concern was only this marionette lines, but if you see her nasolabial marionette, both are like grade 3, grade 4, very deep lines. So I had to give the lateral lift, like for the cheeks, then for the mid face, and also for the lower face. And so I have almost used 5 ml on her face. So I have used the entire 1 ml on one side for the mid face, and also I have done her CK4 to
Okay.
give the lift for the marionette line, and I have injected in the marionette lines as well, and we could achieve uh, decent result. Also, if you see that in this picture, she is a little bit smiling, so
Yeah,
that's why the lines are looking lesser, but uh, her lines are lesser. It's not, they are not gone completely. The lines are still there. So the counseling is very important. What they want is that the sad look should go.
absolutely. Yes.
And
So
yeah,
did
so
you use any energy-based device in this patient or any other treatment before
no,
doing the filler?
no, I haven't used, because she wanted
Mm-hmm.
to do only fillers. So
Okay.
I wanted to ask you that would you combine, like, because the tissue is sagging so much
Mm-hmm.
that even the energy-based device won't. I don't think that the energy-based device would work. But what do you feel about doing threads along with fillers for such patients?
Yeah, absolutely. I think she's got a very heavy jowls.
Yeah.
So the threads would definitely, the thread lift would definitely make a lot of difference to the jawline and the jowls. And then topping it up with a filler would probably even reduce the bulk of the nasolabial folds.
So, for such patients, which product would you use? Would you use a lift
So,
or
uh,
volume? Or
for the cheeks, I would use lift because we want something that because her since her
conserve?
nasolabials are quite heavy, we want something that doesn't increase the bulkiness of the face but gives a good lift. But
Yes,
around the mouth, the marionette and the mentolabials, we could use something like a volume.
yes, absolutely right. And we can always combine threading.
We can also use a define for the marionette lines and the area around the mouth.
Yeah, actually, define and volume, I feel, work pretty much closer or
Similar.
similar. So, any product is good. Uh,
Mhm.
would you do threads first, or you'll do threads after the procedure?
No, in her case, threads would probably make sense doing first, and then we can do it at the same time also, or probably at a gap of few days, and then do fillers later.
And when we say threads, which
Mhm.
threads, like cock
I'm
thread?
talking about cork
Cock
threads,
thread.
basically,
Yeah.
yeah, the lifting thread.
You can go on to the next slide.
All right. So he's basically a 55-year-old male, and so he just wanted to look a little fresher, a little younger. So he was bothered by his nasolabials. So we treated this patient again over a period of few months. I usually talk to them and build up the faces over a period of few months because the results are better and long lasting. So in this patient, we've used about 4 ml fillers over a period of 6 months. So I've done a CK1, CK2 with lift because like I said, when you want to lift and don't want to give volume or make the face look too broad, lift works better. Also, like you mentioned earlier, it has a high G prime. So CK1 CK2 was done with lift, and then the area around the medial cheeks and the nasolabials was done something with a product something like Define. So we used 2 ml of lift and 2 ml of Define. over a period of 6 months. So the patient was quite happy because it not only improved his nasolabials, but it improved his pigmentation and skin quality as
Yeah, when like those patients who has a little bit of a pigmentation,
well.
because of when you do their fillers, somehow the pigmentation also looks lesser and they get
Absolutely,
fresher. And
absolutely.
yeah, he has got very good result.
Yes.
His
So
nasolabial.
yeah, so it's easier. So then it's easier to maintain these results also. So you can just top it up with one syringe maybe after 9 to 12 months, and then it helps to prolong the results also.
Yes, and plus because he has kept beard and that is hiding most of his chin. So male
Cheeks,
patients they quite
absolutely.
often do this, that they keep beard so that they want that their jawline and their chin should look
Mhm.
longer. So that's why
Yes,
most of the men, like many a times, they keep beard for that reason.
absolutely. Yes.
Yeah.
Yeah.
So when you have to do for such patients, when you have to do fillers, do you ask them to shave and then do the fillers, or
So if they want to enhance the jawline, definitely I ask them to shave because it gives a more precise result. It's otherwise difficult to judge how much fillers they need and how much enhancement has to be done. So yeah, if you are doing the jawline and the lower face, I definitely ask them to shave and come.
yeah.
Yeah,
Next
and
one.
yeah, I think we're done with the
So,
cases.
yes, we are done with the case studies. That was the last slide.
All right.
Uh, would you like to take up the Q&A now?
Yeah, sure.
Before we do that, just little bit on complications. So the important complications, most of the time, like if you know the anatomy well, if you aspirate, or most of the time if you use cannula, uh, there are minor complications which happens like swelling, redness, bruises, and we can manage it. You have to counsel your patient in advance and tell them that this is going to happen. Like what you should be able to tell them that what exactly happened immediately after injecting, what is going to happen the next day, and what will happen if they get bruises. You have to tell them that you may get bruises. You have to hide it with a concealer, and it takes 5 to 7 days for the
Absolutely. I think
bruises to.
preparing the patient for a filler is important. So counseling them, taking consent, and making sure that fillers are not done close to any important event is important. So I think minor complications like bruising, swelling can be managed easily. Have you seen any other complications, Dr. Sadhna, besides these?
Yes, I have done like I had to highlight some patients. Uh, Highlighting patients like for two things. One, when the product got little superficial, and when the product gets superficial, and when you get a bleb or a nodule, to dissolve that nodule is relatively easy. We have to highlight it, and you can highlight it. If there is superficial product, you can always mold it and try to dissolve it by molding. But still, if it is popping out from somewhere, then you can highlight it. But yes, I have encountered even vascular complications, and yes, the highlights was done for such cases also.
Yeah, I think even superficial injections in the tear trough can give rise to the Tyndall effect, which is the
Yes.
reflection of light. So it makes the under eye area look bluish green. So in that case, also we may need to highlight a bit to reduce the Tyndall effect.
Yeah, and when you highlight, uh, sometimes what happens at the moment you highlight, uh, there is a depression, and
Mhm.
then the patient wants you to correct it immediately, but you
Mhm.
have to wait at least for a week or two
Yes,
for the highlights effect to go, and then you can repeat or correct that remaining area with the filler.
yes, absolutely. So yeah, I think besides this necrosis, granulomas are some other complications that can be seen. But usually these are seen when probably a sepsis is not followed or a proper patient history is not taken. So I think otherwise these are not very commonly seen complications.
Yes.
Yeah, and
And
Dr. Sadhana, what is the how do you highlight? What is the dilution that you use?
yeah, so so when you have to dissolve, there are two theories. Uh, in Heine days, you add 2 cc of normal saline,
Yes.
and then that 2 cc of normal saline, once you
Mhm.
add it in that, you take it is 1:10. So you take 2 units of Heine days, and then again dilute it to the marking of 10
Mhm.
in the insulin syringe. So that is 1:8
Eight. Yeah.
dilution. Yeah. But what I normally, I mean, earlier I used to do
Mhm.
this formula to dissolve if the product is superficial. But then, when there is vascular complication, it is always better to dissolve the Hynidase into
Mhm.
5 cc of normal saline
Mhm.
or lignocaine. And then, once that 5 cc is ready, and then you have to just flood it
Yeah,
with the
absolutely.
Hynidase. So then there is no dose or no dose means there are no units. So normally, if you have to dissolve a nodule, you probably the for the from the ready Hylase solution,
Mhm.
you will put 1 or 2 units.
Mhm.
But when there is a vascular complication, you will just flood the area with Hylase as much as possible.
Yeah. So I think in so any blanching or any pain is something to look out for after doing a filler, especially in the initial few days of after doing the filler. So if patient experiences any pain or any blanching in the area, you have to inform them to contact you immediately.
Yes, it's always better that after the procedure, uh, tell your patient. Many a times,
Mhm.
patient says that I will come back after 8 days, but
True.
always call them after 48 hours just to evaluate, or at least tell them that if you see any redness or
Mhm.
any bruise also in that matter, please inform us, and so that you can immediately call them. And that's also something about post care, like Dr. Siddhi, what do you give after the procedure?
So usually, I unless there's some erythema bruising, in that case, I ask them to apply some arnica ointment or something like a Cicabayo cream or ice application at home. Unless I've done like a full face at the same time, I don't really give any anti-inflammatory or antibiotics. Only if I've patient is traveling or I've done too many fillers at a go, that is when I give them oral anti-inflammatory or sometimes even oral antibiotics.
Do you give oral steroids to your patients?
Not to all patients.
Yeah, sometimes some patients, they have like important, like they plan sometimes their procedure just say 3 days prior to the important event or 5 days prior to the important event. Then in such cases, I give them oral steroid,
Mhm.
20 or 30 milligram, just for first 3 days.
Mhm.
And sometimes I then give them topical steroid
Okay.
mometasone also.
All right. So I think we can take the questions. Yeah.
Do you want me to read it out to you, or you will take it from the Q&A box?
Yeah, I think we can go alternately maybe.
Okay.
Maybe you can read it out. Yeah, that'll be better.
Okay. So the anesthesia one you've already answered.
Mhm.
Let's get back to the question on repeating the procedure for teardrop.
Acha, for tear trough, first, like I don't know how much I'll be visible on the Zoom, but below, like you should press just below the, what do you call it, medial canthus. And sometimes what happens that if there is under eye bags, it just pops out. And then you have to avoid the under eye bags. And so you will mark the lower border with the pencil, and then you don't, that's your upper limit, and that you should not inject closer to the lid. I usually do tear trough with cannula. So I uh, I draw the hindrance line, which is from the mid, it's the midpoint between the tragus and the nose, and then it's another vertical line from the lateral canthus to the angle of the lip, and at the junction, that is the area where I enter my cannula from there. And some many people, they don't give local. I give local also at the entry point, and from there I enter my cannula. And as I told you that this is your upper border, and you have to draw the lower border, because sometimes if the product is not placed properly in the tear trough, and if it goes below and above the tear trough line, then that gives lot of like valley and mountain kind of a effect, and it doesn't look nice. So enter from here, and then you can do fanning, aspirate and do fanning, and then you can fill that area completely, like the tear trough you can fill completely. Then from the same entry point you can also fill the lateral
That.
area of the eye. And if you're doing the mid phase, then also you can enter from the same point, and you can uh, place the product on the malar eminence.
Yeah.
The next question is, do you give HSV prophylaxis before procedure?
No, it's not necessary. It's not needed. We usually don't, at least I haven't come across any herpes post fillers, so it's not
So
necessary.
sometimes, many a times that some patients, they don't know that this is a concern. So many a times when they come to us for, and it happens when we are doing the lip fillers. Many patients, after doing lip fillers, sometimes you see that their herpes is getting active. And if the patient is new to you, like if it's a first time patient, and the patient has, and if you have forgotten to ask this history, uh, and if they get herpes, that after getting the lesions only you get them, you give them a cyclovir, and not as a prophylaxis.
Okay. The next one is, what is the dose of Hyalase?
I think we already discussed that.
Now highlights in detail, that you get a vial of days. In that you add 5 cc of normal saline or 5 cc of lignocaine. And when you are diluting it with 5 cc, then that entire 5 cc you can take in the
You take it in the insulin
insulin
syringe,
syringe,
yeah.
or yeah, or you can take it, you can remove the entire 5 cc in a 5 cc syringe, and then transfer it into the insulin syringe, and then flood the area with Hyalase. But when you want to when you want to dissolve a particular area where the product is superficial, then you can also use a 2 cc, you can dissolve it, sorry, you can make the Hyalase with 2 cc of normal saline, then take the liquid, take the Hyalase from that in, and make it 1:10 ratio dilution again with normal saline. Is it clear?
Okay.
Complicated?
Uh, Next question is icing recommended after fillers?
Yes, definitely. You want to reduce the inflammation and you want to reduce swelling. So you can ice immediately after the procedure. You can ask the patient to ice at home as well, especially if they are experiencing any discomfort or even any pain.
Okay. The next question is about post procedure. So, after the filler procedure, what is the maximum time duration during which the patient can get complication?
So sometimes what happens that the complication can happen on table also. Like you start seeing the blanching or erythema on table, or sometimes they notice the erythema, or sometimes a nodule or like a lesion like insect bite or acne, or a folliculitis kind of a lesion can happen next day, like in 24 hours, or sometimes it can happen after 48 hours also. Uh, Sometimes the complication can look like a bruise or a hematoma and can turn into a necrosis, uh, maybe on the third or fourth day. That's why it is very important to call the patient after 48 hours. That if it is a bruise, it is just for for you to evaluate whether it is a bruise or a
Yeah.
hematoma, or whether you got a
Yeah, but most complications, if they have to happen, usually we notice it within 48 hours.
exactly.
Yeah.
All right. Uh, yeah, is there something else you want to add?
I think someone is asking which software you use for the pre-post
Yes, I
procedures.
was coming to that. So there was one question on software and another one on the best book to read on facial anatomy for fillers.
Okay. So I use this app called Photo Collage for comparing the pre and post. It's very simple to use, and you can use both the horizontal and the vertical formats. So it's pretty easy to use.
Yes. See, for books, nowadays a lot of information is there on Google. There are a lot of papers available on Google. A lot of literature you can read from there. Or for anatomy, I think I usually read. I mean, there are a lot of literatures provided by the filler company as well. So
Yeah.
if you when you use the products, they support you with the literature, the course of the arteries and the anatomy and
Yeah, I think for anatomy, the basic anatomy books also help. But if you're beginning with
because
fillers, I think Dr. Di Maio is someone you can follow because he teaches you very basics stuff, how to inject, which points to inject. So I think following Dr. Di Maio will definitely help.
All right, thank you, Doctor. So we are done with the audience questions, but I do
Okay,
have a couple of questions of my own. So, with
sure.
your permission, I would like to go ahead with that. Firstly, Dr. Sadhna, you stressed on the fact that no energy-based device should be used after the fillers. So, what is the ideal time gap between fillers and the use of devices?
no, we discussed what we discussed, that the energy based devices should be used before doing the filler. So, for example, HIFU and radio frequency you do before the filler. So, either you can do like a week or two before you do the fillers sometimes, and then after that you can do your filler procedure. Now the laser, like someone is having someone has wants to do laser hair removal. Now for laser hair removal, you after doing the procedure, 7 days gap is enough. But someone who wants to do laser for acne scars, now acne scar lasers, where water is the chromophore, uh, what happens, the fillers, they are mainly hygroscopic. They swell up, they absorb a lot of water from the body. So when you have to use any energy based devices, especially to treat acne scars, then you have to give a good interval of say 1 month or 45 days before you do your lasers for acne scars. But the energy based devices like HIFU and radio frequency should be done before doing the procedure. And then yes, after maybe when you are closer to 8-10 months after doing the laser, then yes, then you can maybe repeat your energy based devices.
All right. Is there any difference in the volume of the product used when it comes to male and female patients?
So I think more than volume, it depends on the shape and size of the face, whether it's a slim face, it's a chubby face, how old the patient is. So maybe a younger patient would require less ml of fillers, while an older patient or someone who's very lean may require more fillers. So it's more to do with the shape, the age of the patient rather than a male or a female.
Okay, so gender doesn't really make much of a
No,
difference.
like maybe it could be an older patient but very chubby, or it would be a a male patient, but a younger female would be very lean. So the amount of fillers will be more in proportion to the chubbiness, the leanness of the face, than the whether it's a male or a female. Yeah.
Right. And what kind of consultation do you do? Like, actually, I would like to know what would be an ideal patient for you.
Ideal patient would be basically who has some idea about what a filler is, what are the expectations. I mean, they should have idealistic expectations, because with 1 ml filler, there's not much which you can achieve. So so if the budget is a constraint, and you want to start with 1 ml, then they should be more idealistic what can be achieved, and they should understand that you can build up the results gradually over a period of time, and just with you can't achieve great results with just a small amount. So and yes, basically there could be complications like redness, bruising, swelling. So these have to be taken for granted that they can happen. So we try our best that complications do happen, but something like a bruise or redness cannot be avoided. And yes, so basically someone who has a basic understanding what a filler is, what results should be expected, uh, how long the results last, when it should be repeated. Someone who has a basic understanding would yeah, be an ideal patient. And also someone knows where to stop. You don't want an overfilled face, or someone looking like filler result should look natural. The patient should look a better version of themselves. They shouldn't look like a overfilled face or like someone. Yeah.
Right. Dr. Sadhana, anything you would like to add to this?
Uh, so younger patients, like yes, younger patients are easy to treat because they already have a good amount of collagen. Their skin is good, and to enhance the existing younger features is easy thing. I mean that's what every injector wants. Younger patients, older patients, you need to counsel them a lot because they have a lot of expectations. They feel that their all the lines and the sagginess should disappear just with minimum product, which is not possible to achieve that kind of a lift with minimum number of fillers. A lot of time they have budget, everyone has budget constraint, and for that reason when younger patient you can achieve good results with lesser number of product, and older patients, yes, you need a lot of product.
All right. Thank you, Dr. Sadhana. Thank you, Dr. Siddhi, for joining us today and the sixth episode of Let's Talk series. I would like to extend a very warm thank you to all our attendees. Thank you for joining us. And finally, I would like to thank our partners, Galderma, for being a part of this event. From the entire team of Aesthetic Medicine, I bid you all goodbye and a great weekend ahead.
Yeah. Thank you.
Thank you.
Thank you.
Thank you. Same to you. Bye.
Bye bye. Take care.